We're going to do the musculature on the posterior side of the female cadaver. So we're going to take down the skin flaps here so we can expose some of the musculature. Here, do the same thing on the other side. There we go. Starting with the superficial layer of musculature, first one we're going to identify here is going to be Latissimus dorsi, which would be this muscle here, which we've cut from its inferior attachment. So for now we're just going to identify latissimus, move this one out of the way. The next one we want to identify here is the other superficial muscle, and that'll be trapezius. And here you just want to be able to identify the three different parts of trapezius, and that's going to be dependent upon the direction of the muscle fibers. The first part is going to be the muscle fibers going in this general direction here, which will be inferior head of trapezius. The second part, which will be the fibers going more horizontally here, which would be the middle head of trapezius. And then the last part will be the fibers that are going more superiorly in this direction here, which would be superior head of trapezius. And you can see here we've detached trapezius from its lateral attachment along the spine of the scapula and the clavicle. So we're going to take trapezius out of the way here. The next muscle that you would come to is going to be rhomboid, which would be this muscle here. And we have rhomboid major and rhomboid minor. And we can see that they're slightly separated here. So this bit here, and let's use the probe here. From here to here, in this area would be rhomboid major, and this little bit up top here is going to be rhomboid minor. Take rhomboids, and you can see that we've had rhomboids detached from its medial attachment point as well. In this area, before we move rhomboid out of the way, we have another muscle attached to a similar part of the scapula. Here, going up and down, this will be levator scapulae, which is going from the superior angle of the scapula all the way up to the transverse processes of the cervical vertebrae. So we have this one going up and down here. That'll be levator scapulae. If we then take rhomboids, and we're going to move rhomboid major and minor out of the way, and we'll expose the next muscle down, which would be this one here. Spread this out like that. This one here is going to be serratus posterior superior in this area here. Then we move down to the lower portion of the back here, and here I think we'll do this one on the other side. Over there, I think.
For veins, yeah.
Yeah. All right. This one around to this side.
And then
For him, he has right and left.
For serratus posterior inferior, I think we have a better picture on this side of the cadaver here. So in order to see this one, like we did before, we're going to take Latissimus dorsi here and flip Latissimus out of the way. And deep to Latissimus dorsi, down in this area, is where we're going to have serratus posterior inferior. So you can see some of the fibers. Just lift up this little flap here. You can see some of the fibers of this muscle. They're going to be going in this direction here. So you can see a little bit of it there. You can see a little bit more of it here. I'm just going to give you the general outline of this muscle. The top border of it would be right about here. The bottom border here. So right in this area is where you'd find serratus posterior inferior. And again, here's a mediocre representation of this muscle right here. All right, let's go back over to this side. All right, so we're going to take the serratus posterior superior. We're going to move this one out of the way here. And when we do that, we're going to expose two muscles here at the base of the neck in this area, and that's going to be Splenius capitis and Splenius cervicis. So we can see we have two muscles here. This one, the more superior one, there's the top edge, there's the bottom edge. Going in this direction is going to be Splenius capitis, and then the one below it here, which you can see here, along here, here's the top border of it, there's the bottom border of it, that's going to be Splenius cervicis. Moving down a little bit into this area here, with all of those muscles we flipped out of the way, we can expose some of the Erector Spinae muscles in this area. And we have three columns of muscle next to each other here. We have one column here, we have a second column here, we have a third column here. So I'll kind of use the probe. This is right in between the first and the second one. And the first one being closest to the spine in here is going to be spinalis. Then the second one going from here to here, in between these two spots, here is going to be longissimus, and then from here over to here is going to be iliocostalis. And you want to note that all three of these muscles are going to be present approximately from the angle of each one of the ribs, which is right up and down here, in between here and the spinous processes of the vertebrae. Here is where you can have all three of those muscles. So you have spinalis, longissimus, iliocostalis. And this particular region of those would be the thoracic region. So this would be spinalis thoracis, longissimus thoracis, and iliocostalis thoracis in that area. The deepest muscles, which would be the spinal stabilizers, those we can see one small picture of one of them. But all of the deeper muscles are going to be oriented this way, the opposite of those intermediate ones. So Erector spinae go this way for longissimus and iliocostalis, and the deeper ones, rotatories, multifidus, and semispinalis, are going to go in this direction here. We can see two windows into these muscles. If we go up to the base of the skull, up here, right around where we had Splenius capitis, right here in this area, these fibers going up and down in that area, that's going to be semispinalis capitis. So that's one little spot where you can see a little bit of those spinal stabilizers. The other spot is going to be more inferiorly, down here, and we are going to take the aponeurosis for Latissimus dorsi, and we're going to move that out of the way. And you see that once we do that, we expose the inferior portion of those erector spinae muscles here. So we're seeing the base here of longissimus, iliocostalis, and a little bit of the base of spinalis over here. And we're going to take all of those muscles and we're going to pull them over to the side like this. And in this area right here, we see these muscles going in this direction here, which you can see just the end of those muscles right in here going there. That's going to be some of the multifidi muscles we can see a little bit of there. And then deep to this you would have rotatories, and in this particular area down in the lumbar region we don't have semispinalis. We would only have multifidi, which you can see there, and then under that rotatories. We'd have to move up into the thoracic region or into the cervical or capitis region to see semispinalis, which is what we saw just before. Okay.